The majority of diabetics concentrate on reducing carbohydrates, taking medications, and monitoring blood sugar levels, but they often overlook minerals, which are essential for insulin function, nerve protection, and the avoidance of problems. The issue is that most diabetics are deficient in important minerals that impact their health, and if you're missing them, managing your diabetes becomes much more difficult. Today, we're going to break down the top 3 minerals that every diabetic needs. If you're constantly exhausted from body pain or having trouble controlling your blood sugar, this video can be really helpful. Stay tuned, as I'll also be sharing the best foods and supplements to ensure you're getting enough. Magnesium number 1. Magnesium is one of those minerals you don't think about until it starts to run low, and for diabetics, that happens more frequently than you might think. Every time your blood sugar is high, your kidneys work to flush it out, but in the process, they also lose a lot of magnesium, which makes it harder to keep your blood sugar stable. What's worse is that low magnesium makes your body more insulin resistant, which means your blood sugar stays high, which leads to even more magnesium loss. It's a vicious cycle, and most people are unaware that it's occurring. And magnesium helps muscles relax, so it's easier to overlook muscle cramps and twist switching, especially in the legs and feet. If you feel weary all the time even after getting a good night's sleep, that's another sign. If you've been experiencing anxiety or difficulty sleeping, magnesium may be the missing piece. It helps calm the nervous system, so when levels fall, stress hormones take over. Even irregular heartbeats or palpitations can be a sign because magnesium helps heart muscle contractions. Magnesium is essential for producing ATP, the energy your cells rely on. Nerve problems like tingling, numbness, or burning sensations can worsen with low magnesium. Low magnesium harms several bodily systems in addition to causing bothersome symptoms. Fertility declines for both men and women. Low magnesium disrupts menstrual cycles, lowers testosterone, and weakens sperm, making it more difficult for women to conceive and increasing the risk of pregnancy. The nervous system is one of the hardest hit. If you don't get enough magnesium, your kidneys suffer because it prevents calcium buildup and low levels increase the risk of kidney stones. Your libido also decreases because magnesium helps regulate hormones and blood flow. Because magnesium maintains blood vessel flexibility under low oxidative stress, eye health deteriorates. The heart and blood vessels suffer the most when the risk of diabetic retinopathy increases. Without affecting blood arteries, magnesium lowers inflammation, prevents arterial stiffness, and regulates blood pressure. May increase the risk of heart attacks and strokes at the cellular level and tighten blood pressure spikes. Magnesium is essential for insulin to function because it helps activate insulin receptors, which allows glucose to enter your cells. When magnesium levels are low, your cells do not respond to insulin as they should. Low magnesium also causes you to feel exhausted because it hinders the production of ATP, the fuel that fuels your cells. Calcium builds up where it shouldn't, causing muscle stiffness, inflammation, and oxidative damage. Magnesium regulates calcium inside cells. The good news is that with the correct foods, a magnesium deficit can be resolved. Among the greatest sources are pumpkin seeds. Only 1 ounce, 28 grams, provides 4% of your requirements. A cup of daily boiled spinach contains roughly 38% magnesium. Almonds make a terrific snack with about 27% per ounce. And dark chocolate isn't just a guilty pleasure. A single ounce contains 24% magnesium. Another simple way to get more magnesium is to eat avocados, which provide around 15% of your daily requirements in one medium-sized fruit. These foods also support blood sugar regulation and general health. If you're looking for something fancier, there are many high-magnesium dishes that will satisfy your cravings. A Japanese miso-glazed fish with sesame spinach provides more than 60% of your daily magnesium requirements and is high in heart-healthy omega-3 fatty acids. For those who need an extra boost, supplements can help, but not all of them absorb well. For example, a French almond-crusted halibut with sautéed Swiss chard provides about 50% of your daily magnesium requirements and supports insulin function. If you're craving something sweet, indulge in a black truffle and dark chocolate mousse, which gives you over 40% of your daily magnesium needs while satisfying your sweet tooth. Magnesium glycinate is one of the best options because it's easy to absorb and doesn't cause stomach problems. Thorn magnesium biglycinate, which comes in 200 mg capsules, is excellent for relaxing muscles and nerves. A good alternative to magnesium oxide, which hardly absorbs and can lead to digestive issues, is Doctor's Best High Absorption Magnesium, which also contains 200 mg per tablet in a chelated form for improved absorption. However, you must also avoid foods and behaviors that deplete magnesium. Too much sugar causes the body to lose even more magnesium because insulin spikes cause the kidneys to flush it out. Caffeine, especially from energy drinks and sodas, blocks the absorption of magnesium. Alcohol is another major issue that depletes magnesium and interferes with how your body uses it. White bread, pasta, and processed grains are completely useless because they have been stripped of magnesium. Fixing a magnesium deficiency may be the missing component if you've been feeling exhausted, experiencing muscle cramps, increased nerve pain, or blood sugar swings. Even excessive calcium intake, particularly from supplements, competes with magnesium for absorption, making the deficiency worse. Zinc is the number one of those minerals that most people overlook is zinc, but for diabetics, it can be a game changer. The pancreas actually needs zinc to release insulin properly, but without it, insulin function slows down, making blood sugar harder to control. Chronic inflammation, which is common in diabetics, also depletes zinc levels. Diabetes causes you to lose zinc much more quickly than normal because high blood sugar increases urination, and every time you urinate, more zinc is flushed out. Because your body needs more of it to repair oxidative damage, several drugs, such as acetone and diuretics, additionally, inhibitors can reduce zinc levels, increasing the likelihood of a deficit. The challenging aspect is that there aren't always obvious symptoms of zinc insufficiency. Among the largest, slow wound healing is another warning sign. If minor cuts take an eternity to heal, low zinc levels may be the cause. Since zinc is essential for immunity, if you have colds frequently, you might be experiencing severe sugar cravings, which is another sign because zinc controls insulin and appetite. Additionally, skin issues like dryness, acne, or persistent rashes may indicate a deficit. Zinc affects practically every major system in the body, so when levels fall, fertility suffers because zinc is necessary for male hormone balance. Other symptoms include a loss of taste and smell, white spots on your nails, or even thinning hair. Zinc also supports collagen production and skin repair. Low levels cause sperm count, sperm motility, and testosterone levels to drop, which makes it more difficult for women to conceive. Because zinc is linked to testosterone, which increases sexual drive and energy, it can result in irregular cycles and hormone imbalances that make pregnancy more challenging for both men and women. The nervous system also suffers. Zinc helps manage inflammation, which lowers the risk of kidney illness. It also protects nerves, and if there is insufficient zinc, diabetic neuropathy can worsen, producing more tingling, burning, and pain. Because zinc is essential for retinal health, low amounts can exacerbate diabetic retinopathy, which can result in visual loss. Another significant worry is the heart and blood arteries. Without it, zinc helps control cholesterol, prevents arterial stiffness, and reduces inflammation. Heart conditions. Zinc plays a crucial role in insulin activity, enabling insulin to attach to receptors and transfer glucose from the bloodstream into cells for energy, hence increasing the risk of high blood pressure and strokes at the cellular level. Zinc is a powerful antioxidant that fights inflammation and oxidative stress. Without it, cells become more damaged, age more quickly, and function poorly, making diabetes complications worse. The best way to increase zinc in your diet is to eat oysters, which are the top source. Just 3 medium oysters provide you with more than 200% of your daily zinc needs. When zinc levels are low, insulin doesn't work as well, which leads to higher blood sugar and worse insulin resistance. Another powerful food is beef liver, which provides almost 80% of your daily needs in just 100 grams. Pumpkin seeds are a fantastic alternative if you prefer plant-based sources, as 1 ounce, 28 grams, can provide 50% of your daily zinc needs. Grass-fed beef is also a good choice, offering over 40% per 100 grams of cooked chickpeas, while lower amounts still supply about 25% per cup, making them a fantastic vegetarian option. If you like fine dining, there are several methods to obtain more zinc while eating healthily. Sashimi of Japanese oysters with ponzu sauce 1 gram provides more than 200% of the daily zinc requirements, making it one of the zinc-richest foods available. About 90% is provided by French beef tartare with 150 grams of quail egg yolk, which also delivers a high dosage of bioavailable iron. A cuisine with a Mediterranean flair, such as grilled lamb chops with a crust made of toasted pumpkin seeds. 80% of daily zinc requirements are met with 180 grams of lamb and 1/4 cup of pumpkin seeds, which also include vital minerals that promote hormone balance and insulin function. When diet is insufficient, high-quality supplements can be helpful. The optimum forms are zinc picolinate and zinc bisglycate because they absorb effectively. Because it is easy to digest, Thorne Research zinc picolinate 30 mg per capsule is a fantastic choice. Another good alternative is Now Foods zinc glycinate 30 mg per tablet, which is chelated for improved absorption. Most diabetics do well with 15 to 30 mg daily. However, because zinc and copper compete for absorption, long-term consumption should be balanced. For example, high-sugar diets are a primary source of zinc insufficiency because they raise insulin demand, which in turn causes higher zinc excretion through urine. Alcohol is another major issue because it depletes zinc and causes inflammation, which exacerbates insulin resistance. Whole grains and legumes include phytates that can hinder zinc absorption, but sprouting or soaking them helps. Too much calcium, particularly from dairy or supplements, interferes with zinc intake. Junk food is another problem since processed foods deplete zinc levels by causing inflammation and lacking minerals. One of the most underappreciated elements for diabetics is zinc, which is crucial because without it, insulin function is weakened, blood sugar control is more difficult, and diabetes complications occur more quickly. Insulin sensitivity can be improved by increasing zinc intake through diet or supplementation. Shield the nerves, assist the heart, increase libido, fertility, aid in wound healing, reduce sugar cravings, and boost immunity. Chromium is number 3. One of those minerals that nobody talks about is chromium, but if you have diabetes, it matters more than you might think. Your body naturally loses chromium through urine, and the more sugar in your blood, the more difficult it is for your kidneys to remove it. This is problematic since chromium is taken with magnesium. Your body doesn't store much chromium, so you need to obtain enough from food or supplements. Stress, processed carbohydrates, and frequent urination all deplete chromium even more since it helps insulin transport sugar into your cells. Low chromium may be the cause if your blood sugar has been difficult to control even though your routine hasn't changed because chromium deficiency often mimics normal diabetes problems. Chromium helps regulate insulin and appetite, so when levels fall, your body struggles to manage sugar cravings and hunger. Feeling exhausted, mentally foggy, or sluggish is another sign. Some people even experience mood swings or anxiety. Chromium affects more than only blood sugar in males. It can also impair testosterone and sperm quality, making it more difficult for women to conceive. Because chromium aids in brain function, if the deficit worsens, you may experience tingling or burning in your hands and feet. Low levels can lower sex drive because it's necessary for circulation and energy and can lead to irregular cycles and hormonal imbalances that make pregnancy more challenging. Without adequate chromium blood sugar, your nerves also suffer. Winging more wildly raises the chance of nerve damage and puts additional strain on the kidneys. Chromium shields the kidneys from oxidative stress, and without it, kidney damage from high blood sugar occurs more quickly, which can also impair vision. Since deteriorating diabetic retinopathy has been connected to low chromium, and then there's your heart when harmful cholesterol levels fall, chromium helps regulate fat metabolism and cholesterol. Increases cause arteries to harden and increase the cellular risk of heart disease. As a component of the glucose tolerance factor, chromium functions as an assistant to insulin, enhancing its ability to transport sugar into cells. When chromium levels are low, insulin becomes less effective, allowing blood sugar levels to remain elevated. Over time, this causes your pancreas to produce even more insulin, which exacerbates insulin resistance. When chromium is deficient, your body finds it difficult to use glucose effectively, which makes you exhausted and more likely to gain weight. Chromium also aids in the breakdown of carbohydrates and lipids. The good news is that by eating the correct foods, you can naturally increase your chromium. One of the best sources is broccoli. Half of your daily needs can be met with just half a cup. Although 1 cup of grape juice contains over 40% chromium, diabetics should only consume tiny amounts of this sweet beverage. Brazil nuts are yet another excellent choice. About 30% of your daily chromium needs can be met by only one nut. If you enjoy gourmet meals, several high-end dishes have a substantial amount of chromium. Lean beef is also an excellent option, with 3 ounces supplying 25%. Eggs also contain some, with each large egg offering between 10 to 15%. Sautéed broccoli and Wagyu steak from Japan and Brazil nut pesto provides more than 75% of your daily chromium requirements, along with protein and healthy fats to help control blood sugar. If you want something rich, try a Mediterranean-style grilled lamb chop with rosemary-infused grape wine in steaming asparagus, which provides you with almost 60% of your daily chromium consumption and promotes heart health. Nearly 50% of your daily chromium needs can be met by a French-style duck liver pâté with poached eggs and truffle roasted mushrooms. If food is insufficient, supplements can help. The best forms of chromium are chromium picolinate and chromium polynicotinate because they absorb well and enhance insulin function. Now Food's chromium picolinate is a good choice because it contains 200 micrograms per capsule, which is sufficient to support blood sugar levels without being excessive. Since chromium is needed in small amounts, Thorne Research chromium picolinate is another excellent option. It comes in 500 micrograms per capsule, so for individuals with more severe deficiencies, start with 200 to 500 micrograms daily and watch how your blood sugar reacts. Avoiding some foods and behaviors is equally important because they cause chromium levels to drop more quickly. Diets heavy in processed carbohydrates and refined sugar are the greatest offenders because they raise insulin demand, which causes excessive chromium loss through urine. Dairy can also prevent the absorption of chromium. Processed foods like white bread, pastries, and sugary drinks deplete chromium because calcium competes with it in the body. They also exacerbate insulin resistance. Alcohol is another significant issue. It accelerates the loss of chromium and makes it more difficult for your body to keep levels steady. Although it may not be the first element that springs to mind when managing diabetes, chromium is crucial for maintaining stable blood sugar levels, enhancing insulin sensitivity, and bolstering metabolism. If you have severe sugar cravings, feel as though your blood sugar is out of control, or have low energy all the time, increasing your chromium levels could have a significant impact. If this video was helpful, please hit the like button and leave a comment below. Tell me which of these minerals you believe you should pay more attention to. If you're serious about taking charge of your health, don't forget to subscribe because we have more revolutionary diabetes management tips in store for you. Thank you for watching, and I'll see you in the next one.